So the buzz phrase, of course, is the world is a complex adaptive system. The health system, we hear that all the time, don't we? We hear people talking about the health system, and what they mean is it's this complex creature that's adaptive, it does change, but in interesting ways, not necessarily always because the policymaker or the guideline person says this is the way the health system should behave. It behaves in ways reflecting its complexity. Sometimes it does adverse things that we're trying for it not to do. Although the health system produces lots and lots of good care as well, as we know. That's because the systems that we are embedded in, that we are working on, that we are trying to improve, that we are trying to deliver care in, is the most complex system anybody's ever designed. No one's designed a human system more complex than healthcare. But that's the system that we want to try and improve and do what Paul suggests. Don't do too much medicine. Make it so that the quality of care is better in the long term. So, everyone's invited to join the complexity simulation game. Of course, I'm using the word invite a bit generously. You're already in, you've dealt yourself in, or we've dealt you in. You are assigned to a group of stakeholders. You've already been assigned. You will see the sign on your table which tells you which group of stakeholders you are part of, and your task is to solve the problem I'm now going to give you. Here are the stakeholders. There's the Prime Minister's office, the Treasury, the Minister of Health and the policy staff, the state health systems, the doctors, the nurses, allied health professionals, patients groups and their representatives, the media, and corporate interests. Francine, are you impressed that we did the media? We have the media here. So the problem. It's March 2020. Prime Minister Morrison has received a report from the Health Minister that 30% of Australian healthcare is low value, 10% is harm, and 60% is evidence-based. This, he says to the Minister, is a problem. Prime Minister Morrison says we need to solve this and to do more with less. We need the whole system to accept the 60-30-10 challenge. Some of my favourite people, nurses. Where's you up to in all this? Trying to solve this problem.
We're exploring the common themes behind 60-30-10.
She wants a legacy of better value in the health system, placing a well-informed consumer at the centre of the health system. And so it's about doing the right thing and making better value care easier to do for everyone.
Is this answering the question or trying to get re-elected?
So if I understood your original question, it was to comment on the process itself, and the process, as we've now, I guess, decided or discovered, was very siloed.
Yep.
The tables didn't really talk to each other, and in effect that's an analogy of the actual health system.
Firstly, this kind of a challenge, you know, from the corporate perspective, is an incredible opportunity for us to bring innovation, particularly kind of data and analytics techniques, behaviour change, big data, all of those kinds of things. It's a fantastic opportunity to use that to really harness the opportunities of big data, precision medicine, all of those things, to make sure that the care we're providing is ever more focused on what people need.
At the end of the day, you may not be able to change a complex system readily, but they do change. Systems do change. The system we've got now is much better than the system of 30 years ago. So there's no question that health systems change and improve over time, despite the complexity, the stakeholder inertia, all the things we've seen today. So there is hope, and I want to leave on that optimistic note. You can definitely nudge, influence, and shape health systems over time. There's just no linear magic wand type solution to these problems.